This is Fayetteville Fights Back. Now we're being simulcast today on the big 95.7 WKML, Foxy 99 The Big Stick, Old School 107.7 Jams, 96.5 Bob FM, and Sunny 94.3.
And we're here to discuss the ongoing opioid crisis and to begin a conversation about what can be done about it. For the next hour, we'll try to answer questions and offer some help. Our partner in this broadcast is Cape Fear Valley Health. I'm Jane Doe from Foxy 99, and my co-host is Don Case from WKML.
Thank you, Jane. Let's now hear a question, an answer rather to a question from our esteemed Governor, Roy Cooper. Governor, can you give us your perspective on the opioid problem that we're facing and what your office is doing to combat that?
We know the opioid crisis in North Carolina is extremely serious, and it's increasing. Last year in North Carolina, we had about 1,360 North Carolinians die from unintentional overdose. That's 25% more than in the year 2015, and we think on an average of about 4 people a day in North Carolina are dying from overdose, and we know that this problem is an epidemic and that nationwide there are more people who die from unintentional overdose than from automobile accidents. It's affecting our economy, it's affecting the cost of health care, and the tragic effects that it's having on families all over North Carolina cannot be underestimated. So as governor, I have made fighting the opioid crisis one of our main priorities. I served on the President's Commission on a national level, and I also put forth a North Carolina opioid action plan that works to coordinate efforts all over North Carolina. We've worked with Attorney General Stein and the North Carolina General Assembly, and I signed into law the STOP Act, which significantly restricts prescription opioid that we know has started a lot of this problem and that we know getting people killed. And we believe also that we need to make sure that people have access to treatment in North Carolina, because we know that this is a brain disorder, and law enforcement has come to the realization that yes, we have to go after the drug traffickers and the drug kingpins, and we're working with the State Bureau of Investigation and the DEA to hit these high-intensity drug trafficking areas, and we're working hard to arrest those kinds of people. But at the user level, law enforcement knows that it cannot arrest its way out of this problem. So we have law enforcement and health professionals all over North Carolina working to get people the treatment that they need. And one thing I know for sure, that we have to have more people covered with quality health insurance. The North Carolina General Assembly should work with me to expand Medicaid. We need to make sure that private insurance policies cover more substance abuse. And we know that that is the way to help get us out of this problem, reduce the deaths, reduce the loss to the economy from our employers who are dealing with employee populations who are addicted. And I'm excited about what we can do. I do know we have to be determined to work together to make sure that first responders have life-saving naloxone that can revive people who have had overdoses, to make sure that people get into treatment, that we have rapid deployment efforts to do that. Clearly, it's not just prescription drugs now. It's changed over mostly to illicit heroin and a drug called fentanyl. So the challenges are great. I'm glad that in Fayetteville and in Cumberland County today, so many radio stations are involved in this effort to make sure that we tackle this problem, to make sure that the public knows about it, and that we pool our resources to get things done and to save lives. Now I'd like to turn this over to Don Kate and Jane Doe.
Thank you, Governor Cooper. Let's begin our first segment where we can answer some questions with our medical experts.
If you're wondering, you are listening to Fayetteville Fights Back, a community conversation about the opioid crisis here in Fayetteville on Foxy 99, 95.7 WKML, 96.5 Bob FM, Sunny 94.3, and 107.7 Jams. A big thanks to a true servant in our community, Darvin Jones of Fayetteville Valley. Darvin, would you be kind enough to introduce our first segment of medical guests, please?
Thanks, Don. Sure will. First, we have Dr. Roxy Wells. She's the president of Fayetteville Valley Hoke Hospital and Bladen County Hospital. Then we have Dr. Michael Zappa, who is the president of Highsmith Rainey Specialty Hospital. He is the chief of emergency services and the associate chief medical officer of Fayetteville Valley Health. We have Colonel Don Algio, the Walmack deputy commander of medical services. And we have Dr. Karen Smith, PA, who's the North Carolina Academy of Family Physicians Physician of the Year.
Okay, well, could somebody please tell us about the increases in opioid abuse that EMS emergency rooms are seeing in the area?
Sure. Unfortunately, over the last 2 years, we've seen a doubling of opiate-related overdoses coming to our emergency departments. So we're talking about 2 years ago, approximately 100 to 125 patients in a month, and now we're seeing 200 to 250 every month. And those are the people that are making it to get to the emergency department. That's not counting the people that don't survive and are basically dead and not even transported to a hospital.
Incredible numbers. For those that may not know, what actually is an opioid?
So an opioid refers to derivatives of the poppy plant. So that's where opium comes from. And there are various substances that come from opium, like morphine and codeine. But structurally related to opium are the opioids, which are synthetic derivatives molecularly similar to opium that have the same effects. And those are things like Demerol, Dilaudid, oxycodone are all opioids. But opium, opioids, opiates all have the same clinical effects. They all have the same high risk of addiction and all have the same potential fatality.
Okay, while we still have you,
Okay.
and you answered the question about names for opioids, I heard you mention a couple of those names. Can you let everybody else know some other names that are common names for opioids?
Sure. Just to go through, you have oxycodone, Percocet, codeine, Tylenol number 3, Dilaudid, fentanyl, Duragesic, like I said, OxyContin, heroin, of course, that's out there as a street drug. Vicodin, hydrocodone, methadone. I think those are the big ones.
These names you just mentioned, exactly how do they work and why are they so darn addictive?
Well, they have two main properties. They're great painkillers. So for people who are experiencing physical pain anywhere in their body, it can relieve it. But at the same time, it gives a euphoric state. So that combination really sets people up for trouble. Because what happens is it's very easy to develop a tolerance. So the longer you take it, which can be a period as short as a couple of weeks, the body will require more to get the same effect. So not only to control your level of pain, it takes a higher dose, but also a higher dose to get that euphoric or high feeling.
Okay, I don't know if you can answer this question, maybe somebody else, but how does an accidental overdose happen?
Dr. Smith?
An accidental overdose can occur when an individual is taking pills of the many that have just been listed, and they don't realize how many they have taken to get that either relief of pain or the sense of euphoria. And the body has now consumed too much medicine, and it stops the respiratory system in the brain, and the body does not breathe, and the person will die. But we also must keep in mind It overdose occurs with the children in households where they think they're eating candy and they too will overdose. So we're seeing many instances of overdose beyond that of just the adult population or our adolescents who are experimenting with pill parties, and also our children, innocent victims of drugs that are not properly put away in the homes.
You just mentioned about, you just mentioned the death word, which is just so heartbreaking. One of our, I think on Facebook, one question we were asked, when should I call the EMS if someone has taken one of these opioids? Are there any external signs that we may be able to know that they may be under the influence, and if so, when to call EMS?
Yeah, this is Dr. Aljo from Womack, and that's a great question. I just wanted to reiterate one thing to add to my colleague. The accidental overdose is oftentimes unintentional because they'll do something like have a drink, take any kind of alcohol, or they'll combine it with a benzodiazepine, Valium, Xanax, or some other medication. Sometimes it can even be a polypharmacy issue where they were prescribed other medications by a provider that may not have realized that they were taking high-dose opiates, and the combination of those medications shut down the nervous system as described, and they go into respiratory failure. To answer your question, sir, the best thing to do is as soon as you see them starting to be obtunded or sleepy or they're not responding, hopefully if they're a pain patient, they've already had a Narcan rescue that was given to the family and taught how to use that to save them right then and there. If not, then call the EMS immediately. And as described previously, most EMSs are starting to get that training and get onboarding with naloxone rescue.
You mentioned Narcan, right?
Naloxone and Narcan,
Right,
same thing.
So you said it's a reversal agent to bring them back?
For opiates,
Opiates.
yes, ma'am.
So it can, so if they've given it, I mean, if they give it soon enough, then they can just bring them back to be okay. But I've heard also, like, when she was talking about parties, that the parties, they do the same thing, that these kids are now taking these Narcans and doing the same. Is that, can you delineate on that?
Right, so the two different things. The opiates, any kind of opiate will be reversed by naloxone or Narcan. If these kids are doing tabletop parties or taking other medications, they're not reversals for that. It's not a reversal or a treatment for cocaine or crack or some other overdose potential. So it's a specific treatment for a specific overdose. Did that answer that?
Hey, a big thank you if you just tuned in. Thanks for listening to our Fayetteville Fights Back. This is a community, keyword, community conversation about the opioid crisis here in Fayetteville, and we're doing it on Foxy 99, 95.7 WKML, 96.5 Bob FM, Sunny 94.3, and 107.7 Jams. You mentioned Narcan, doctor. If I want to go get one, do I need a prescription? How do I get my hands on one?
We are very fortunate in that our state has made Narcan available, signed by an order from our State Department of Health and Human Services Medical Director. If you have someone in your home, or if you yourself feel like you may have the need for Narcan, or a family member who has the need for Narcan, you may go to our pharmacies. There are pharmacies which are listed, and they can provide the Narcan so that you will have that emergency access in your home for immediate use.
You mentioned go to your pharmacy, and you also mentioned a list of pharmacies. Where do we find that list of pharmacies?
There would be a list of pharmacies listed on the Department of Health and Human Services website, but we also know that our health department, Cumberland County Health Department, Hope County, Scotland, Robinson, all of the health departments that are servicing our area can provide that information.
Your Health and Human Services, is that DHSS
Yes.
.gov by chance?
That would be it.
Okay, a lucky guess. Thank you.
Thank you.
All right, so you mentioned how opioids are so addictive. Can somebody help out on how we can take them safely? Is there a safe way to take them?
This is Dr. Aljo again. Yes, absolutely. The best way of taking opiates is to go low and go slow. So when you're starting out, and usually it's for acute pain, and as my colleague mentioned before, when you have tolerance and you have to go up on the medication, that's the first sign that maybe this isn't the best treatment, and you need to be reevaluated for that. But taking them as prescribed is key, and making sure that you have that constant dialogue and relationship with your healthcare provider to make sure that you're engaged in a safe practice and you're not combining medications that are potentially fatal.
Talking very serious stuff here. You mentioned the death rate earlier, excluding death. What might these opioids do to my body?
In the most serious case, what happens is you get put into a coma. And as that coma gets deeper, your brain stops telling your lungs to breathe, and your respiratory rate gets slower. What that does is decreases oxygen. So then you get organ damage everywhere. So sometimes, unfortunately, people show up with an overdose, they get treated with naloxone, we quote, save them. Yet they're brain damaged from the lack of oxygen. They have a stroke, they've had a heart attack, they've damaged their kidneys because of that period of low oxygen. So that's what happens. When you take too much opiate, when you overdose, you are truly killing yourself by shutting your body down. You know, one of the sad statistics is, as we've looked over the last 2 years, the majority of the overdoses that we see are the 18 to 35-year-olds. That's over 50% are in the 18 to 35-year-old. But a close second, about a third, are in the 36 to 53. So if you take that population of age 18 to 53, that is the majority of the overdoses that we're seeing. This is our community at the height of their productivity, and this is what they're suffering from. It's a huge problem.
Would you speaking on overdoses, sir? I'm sorry. Can you tell us some signs that we should look for when someone has overdosed?
Sure. You know, early on, they're just going to be sloppy and have slurred speech. Kind of like someone who's drunk. But then they're going to get to the point of sleepy. Then they get to be in a deeper sleep, and it can even be, funny snoring. It can be the early signs that their respiratory center is slowing down. You'll notice their pupils get really small. We call it pinpoint pupils. Typically what happens with opiates. They can get very pale, very sweaty. They can turn blue. So those are the kind of signs. You see that's a 911 call immediately.
One of the questions that came in earlier, I hear heroin and opioids used in the same sentence. Are they the same?
In practical terms, yes. So heroin comes naturally from the poppy plant, and opioid is a synthetic form. So molecularly, very similar. They're going to do the same exact thing to the body.
Well, our next segment is going to deal with the law enforcement aspect of this issue. Mr. Darvin, if you could introduce our guest for this segment, please.
Okay. We have Chief Gina Hawkins of the Fayetteville Police Department. We have Sheriff Ennis Wright, Cumberland County Sheriff's Office. And we have Attorney General Josh Stein joining us today.
First question earlier today is heroin making a comeback?
This is Attorney General Josh Stein. First, I just want to thank Beasley Media Groups for doing this. It's an immense community service because people hear that the opioid epidemic is the #1 public safety, public health issue out there, but there's a lot of confusion around it. And so raising the public understanding of it and frankly reducing the stigma around addiction is a really critical part of ultimately solving this problem. And Beasley Media Group is doing that today, and I want to thank you. Heroin is decidedly making a comeback. What happens is most folks get addicted from a prescription drug. Either they got a prescription themselves and it was for too long a period of time and they got hooked, or what is practically more common, actually more common is There are extras in a medicine cabinet. Somebody had a knee surgery and they got 30 pills, 50 pills, and they put them in the medicine cabinet because they only needed 5 or 6. And then a young person or somebody with addiction gets their hands on them and they get hooked. Well, once they get hooked, if they can't get additional prescription drugs, but their body is screaming for that morphine molecule, they'll go to the street where heroin is actually cheaper to buy on the black market than these these prescription drugs that get diverted to the black market. And so more people are dying today in North Carolina from heroin or heroin laced with fentanyl, which is an incredibly potent drug. But that combination is killing more people now from overdose than the prescription pills themselves.
When you answered the question I was going to ask about if doctors' offices in the emergency department were seeing more pill addiction or heroin addiction, it just sounds like you said that it's more heroin.
Well, it's both.
It's both.
It's
Okay.
both. There are more people who are addicted to pills than there are addicted to heroin. But most people, the large majority of people who are addicted to heroin, started out addicted to the pills. And when they couldn't get their fix from the pills, they moved to heroin. The reason why heroin is deadlier and the fentanyl is more deadly is because when people get something off the street, they frankly don't know what the quantity is. And so oftentimes they'll take a hit and it'll have fentanyl. Fentanyl is 100 times more potent than morphine. That is insanely dangerous stuff. And so they'll cut it, the drug dealers will cut it and put it in a heroin packet, but they're not precise. They're doing this in their garages. And so somebody might take a hit thinking it's a certain amount, but it ends up being substantially more. And that's why you'll actually see kind of a wave of deaths come through a community where you might have 7 people die in a week's period because it was a bad batch of fentanyl.
You're listening to Fayetteville Fights Back, a community conversation about the opioid crisis here in Fayetteville on Foxy 99, 96.5 Bob FM, Sunny 94.3, 107.7 Jams, and 95.7 KML.
What opioid policies, somebody can help me, are in place at Cape Fear Valley and its clinics?
Cape Fear Valley about 2 years ago introduced a new policy throughout our primary care practices. And basically this policy was to provide clear direction relating to controlled medications for long-term use. It gave our physicians a means to work through controlling prescribing medications. It required a complete evaluation of the patient. It required a pain level assessment on a frequent basis. It also required a controlled medication use agreement that the patient and the physician signed. And it requires physicians to actually look at the North Carolina Controlled Substance Report that's available to physicians now that lets us know where patients have received medications. There's also a risk assessment component where we look at things like mental health, past histories of drug abuse or substance abuse, and it just arms the physician, gives them additional information when it comes to taking care of patients. And it really helps us alleviate patients becoming addicted. If we follow this policy as directed, the likelihood of patients becoming addicted decreases significantly because prescribers have a tool that helps them prescribe these medications in a more safe way.
I think we have a question for our law enforcement professionals. I see, I'm not sure what this is, LEAD. Can you tell me what is LEAD, LEAD, please?
Hi, this is Chief Hawkins. LEAD is Law Enforcement Assisted Diversion Program. So as Attorney General said, we've identified, you're going to see, so far you've heard a lot of things regarding what it is opioid, how does the medical profession. But in law enforcement, we first identify it not for 2 things. Overdoses. We get the first phone call to say you have someone who is overdosed, how can we come and help? So we have naloxone and we administer it, give it to the officers to administer it. So far we've had over 120 saves, reversals of opioid. So what we've done is identify in 2016, how else can we address this issue? How holistically can we get involved to address the overdoses? Because systematically, when someone is addicted to something, they're going to try to find a means in order to get that addiction. So it may result in someone doing things like criminal activity, breaking in vehicles, breaking in homes to get things to sell. So what the LEAD program does is identify, you have to volunteer. If you overdose within 24 hours, we identify, we group up our partners, we identify individuals who say they're just tired of the addiction and they need help. So we connect with partners to give them that help. They go into a program, and the results have shown since 2016, there is an 80% percentage that people will not go back into criminal activity once they're a part of this program. So far, we have, since 2016, 22 individuals volunteer for this program.
80%, that's phenomenal. Great
Yeah,
job.
that's great.
And if I could just follow on that, because Fayetteville was an early leader in adopting this LEAD initiative, law enforcement assisted diversion, but there are other communities around the state that are embracing similar models. And the idea is, as the governor said, law enforcement has to come down hard on the traffickers who are bringing this poison into our state. They're killing people and they're making millions. But most of these folks are addicted. They are sick. They have an illness, substance use disorder. And we have to ask ourselves as a community, is it more effective to help that person get healthy and well, or is it more effective to put them in jail and they come out and they're still addicted? And then they just get on that treadmill. And so I really want to compliment Fayetteville Mayor and Chief for taking this leadership initiative.
I just want to piggyback on what the chief said. Just like she said, there's a program that they have. But looking at my jail count this morning, there's 784 people in that detention center over there. A lot of those folks are substance abusers. Just like she said, we have a gentleman over there in Wayne County. He assists us with trying to identify these people. But if we don't do something for these people, all we doing, the taxpayers doing, is continuing spinning the wheels, spending the money. Because like I said, a lot of those folks over there needs help. Now, my job is to do, as law enforcement, is to get out there, just like you said, is come down on these people. As Compton County Sheriff in the Sheriff's Office, we execute 2 search warrants a week. And a lot of, like Ms. Stein was saying, that a lot of these folks are heroin. It's so cheap and easy for these people to get that, and like I say, they don't know what's been laced with this stuff. We have a lot of, in 1 week, we had 3 ODs right behind each other, you know, and that's sad that we have that. So, like I said, again, these people that sit in the detention center, they need help, and we have to do that.
Behind you, Sheriff's District Attorney Billy West. Billy, you may want to ask to answer this one if you can. How are the courts dealing with this?
Well, it's certainly an issue that we deal with daily, and as Chief Hawkins talked about, and the Sheriff, the LEAD program has been a pilot program across the state that's been recognized as being successful. But also we have drug treatment courts. We have a veterans treatment court which deal with nonviolent, low-level offenses, and in many cases, the individuals participating in those courts have an opioid addiction. So we're working with our treatment providers, working with our law enforcement to try to deal with this. And again, it's really a 3-pronged approach when looking at the court system. We look at the healthcare providers and work with them about the prescribing. We try to crack down on the drug traffickers and the people that are peddling this poison in our community. And then finally, the users, as the Attorney General and the Governor have said, they have an addiction, and we're trying to give them the treatment that they need. So it's really a 3-pronged approach that we're trying to take part in law enforcement with the DA's office.
Special thanks for wearing the uniform and what you do for our local law enforcement. Thank you. If you just tuned in, welcome. You're listening to our Fayetteville Fights Back, a community conversation about the opioid crisis here in Fayetteville. And you're listening to Foxy 99, 95.7 WKML, 96.5 Bob FM, Sunny 94.3, and 107.7 Jams. In our next segment, Darvin, would you please introduce our folks from local government, please?
All right. Joining us today is Mayor Mitch Colvin and County Commissioner Charles Evans. Welcome.
Good afternoon, gentlemen.
Good afternoon.
What is the city government doing to help?
Well, first of all, I'd like to commend Beasley for these efforts and for putting this conversation on the forefront. We need to make sure as a city that we resource Chief Hawkins and her department. Fayetteville was a leader in getting some of those medications for the reversals that were mentioned earlier. Also now, I understand that we're training our fire departments, who also are oftentimes first responders, to make sure that they have the proper training to administer those things. I think it's important. We've also applied for grants through foundations like the Bloomberg Foundation, and we have a watchful eye for any federal and state dollars that we can bring into our community to help in those efforts with education as well as enforcement where necessary.
Commissioner Evans, on the county side, how are you guys handling this crisis? And wave the flag of Cumberland County, if you would.
Well, first of all, I'd like to follow our mayor's lead, and thank you all for having this conversation. What we do as the Board of Commissioners, we are a Health and Human Services Board, and we work closely with Fayetteville Valley by being trustees of the board. And so anything that they interact with the county, we are for it. But I want to go into this, if you don't mind. Someone mentioned substance abuse earlier, and I know opioid is a big problem here in Cumberland County as well as in the city of Fayetteville. But I believe, honestly, that we need to look at the totality of it. You mentioned heroin and a couple of other drugs, but there's crack cocaine, there's marijuana, there's alcoholism, and I believe that we as a community need to do more. We have so many things that we list as priorities. The baseball field, the Civil War Museum, and things of that nature. But we are talking about an issue now that's taking people's lives and destroying families. And so this conversation is great. And I do believe that if citizenry speak up and speak out about the concerns that we have in this problem with addiction, that we as elected officials will listen and do more to combat this illness. I want to applaud everybody that's taking a part in this and doing what they can, sir.
Thank you.
Is there funding for available? Is there funding available for outpatient treatment?
What we have now is we have very few. We have Roxy Detox Center and also the local hospitals, and that's sad to say. And I wish I could elaborate more on what type of funders we have. But as stated earlier, there is an absolute need for us to do more as far as substance abuse is concerned.
And I'd like to piggyback on that. I had looked at some other communities. Charlotte, for instance, had a regional detoxification center that was resourced, even though the county, like Commissioner Evans said, is primarily responsible for health and human services. This is a community problem that impacts the citizens of Fayetteville, and I would like to see about any available resources that we could put in possible collaboration with the county or some of our other regional cities and mayors to have some type of regional presence to treat as a treatment center, and maybe Fayetteville would be the hub for that, since we, kind of have that problem that sets us apart.
Mayor Colvin, you're reading my mind. You mentioned grants. Does the county have a good working relationship with the city with the Fayetteville? We're talking, we saved 100, Chief Hawkins mentioned, we've saved 120 lives so far. I mean, this is exciting. So I'm sure that you both are on the same sheet of paper, if not, so we got some work to do there, sir.
We in spite of what you may have heard, we have a great relationship. We collaborate on a number of things, and we're going to do more of that. And problems like this that are on the forefront for our community and our constituents, because 2/3 of Commissioner Evans' constituents live in the city of Fayetteville, and so this is a problem that is on the forefront for all of us, and I think that if there are collaboration opportunities, I'm all for it.
Let's say the grant you applied for, Mr. Mayor, if you get that, is that just for the city, or will that be used for Cumberland County as well?
Well, any grant that we are the applicant, the primary applicant, I'm sure will have restrictions to be used within our jurisdiction. But I said that we've partnered on grant applications before with Matthew funds and possibly some other things that are in the pipeline, and so we can make sure that we get the treatment and get the resources applied properly.
Thank you
And
both.
to piggyback on what Mayor Colvin has said, yes, we do have a good working relationship, and we've done a number of projects together. Still continue to do some projects. And this is one project that I believe that the members of the City Council, as well as the Board of Commissioners, we can work together and formulate or finding out what grants are, what funds are, to do a better job in combating opioid and substance abuse, period. And this is something that's much needed in our community. And yes, that relationship between the city and Fayetteville, we would do everything that we possibly can to combat this issue.
Do you both think that might be more effective if the county manager and the city manager's office were to communicate, maybe, meet together versus as a council?
Absolutely, and from the city's perspective, we've made it clear to our city manager and leadership that we need to explore all opportunities to work with the county. We have a joint meeting tomorrow, in fact, and we look to do some great things, and this could possibly be a topic of discussion.
You want to interrogate him some more?
No, interrogate them.
Well, thank you, Mayor.
All
Thank you,
right.
Commissioner.
Thank you, guys.
Appreciate your
Thank you so
presence.
much, thank you. Great
And-
job, great job.
We should mark the tape on that one, huh?
All
We got some
right, that was
commitments
great.
here, huh?
That's great. Now we want to talk about one of our final segments. It's primary treatment and recovery. So our final panel of experts, Darvin, please introduce them to us.
Okay. With us, we have Mr. John Bigger, who is Cape Fear Valley's Corporate Director of Behavioral Health and Sleep Medicine. Mr. Lewis Leak with Carolina Treatment Center. Ms. Tabitha Goodpasture with Fayetteville Treatment Center. And Ms. Sarah Hollick with Cumberland County Communicare. Everybody step on forward.
While the folks are coming to the microphone, a big thanks to Cape Fear Valley. This is being broadcast through the Cape Fear Valley website, so thank you so much. We appreciate that. We have a wonderful medical community here, so thank you very much. Cape Fear Valley, the website, this is being broadcast. And if you're listening online, on air, thank you. What you're listening to is a community conversation. It's called Fayetteville Fights Back. And we're talking about the opioid crisis here in Fayetteville on Foxy 99, 95.7 WKML, 96.5 Bob FM, Sunny 94.3, and 107.7 Jams.
Okay, let's see. So, what are is this right here? What are some signs and symptoms? I can't read today. What are the signs and symptoms of abuse and/or addiction? Anyone answer that?
Lewis Leak, Program Director, Carolina Treatment Center. When we're talking signs of addiction, especially when it comes to opioid use disorders, we're looking at the individual for things that change socially, especially for them. They become withdrawn, not only from family members, friends, community, things like that. Additionally, you will find those individuals maybe taking more time off from work, more time off from school. Some things that is really noticeable are drug-seeking activities where they'll spend a lot of time seeking out either pills or heroin to kind of maintain, because they build a tolerance over time, which creates a greater need. So the euphoria stage leaves them, and now it's about just being able to survive day to day. And because their brain starts to become accustomed to it and the tolerance starts to build, it requires more and more medication or more and more usage over time. And so you'll start to notice things where maybe because now they're not working, they start stealing money or pawning items or whatever it takes to fund the habit that they now have. And so it's subtle. It starts out really small, and then it expands into larger things. Because it is a brain disease, you will normally see a person do a lot of things that are totally out of character for that individual.
Thank you.
I would also add that there are some significant changes in appearance. Dr. Zappa mentioned the pinpoint eyes, the sunken, hollow features, like they've lost a lot of weight, where in the past they weren't real thin, or they just disheveled looking. Just a lot of health and physical appearance changes that you can notice in somebody, that they just aren't appearing the way they used to in the past.
I would just like to add that I wish we had this conversation 2 years ago. It would have made a big difference, and probably not in your life and also in my life, because we're probably part of that community that's people that we actually cared about or care for is part of that 1 out of 4. So
Right.
I am thankful that we are having this discussion right now. Thank you for sharing that.
Question that came in earlier today. Do you find you're treating more patients with pills or heroin addiction, or both?
Both. I coordinate the Roxy Avenue Detox Center. About 75% of our detox patients are from opiates, and alcohol is the other leading contributor. Somebody mentioned substance abuse as a whole in this community. Yes, it's ravaging our community, the opioids in particular, but all substance abuse it has an impact. But pills and heroin use are combined. An opiate, an opioid, doesn't matter which one it is, it's still affecting them.
Is there a crisis center or a
I
hotline?
think she has a follow-up
Oh, you
question.
do, I'm sorry.
Hi, I'm Sarah Halleck from Cumberland County Communicare, and we work with adolescents and adults for substance abuse. And I just wanted to add that in the adolescent world right now, marijuana continues to be the biggest gateway drug for them, but we are seeing higher numbers of heroin use and prescription pills among the adolescents and young adults too. And so I think that's still a very big concern for us also as an agency and a community.
Commissioner Evans, you were on the cutting edge mentioning the gateway drug marijuana, and it goes from there, so thumbs up.
That's great. No, okay, back to the question, I'm sorry. Is there a crisis center, a crisis line that people can call if they see those signs? And
Absolutely. The Roxy Avenue Center has a crisis evaluation service. It's 24/7. The number is 615-3333. And it's an easy number to dial, and people will answer that phone and direct you in the right course of action for that.
615-3333. Area code 910, 615-3333, and that's 24 hours.
Right. And we also have to make sure to mention our local managed care organization, the Alliance, which is the Community Mental Health Service that funds a lot of the services that we provide. And you can contact them as well, and they can steer you in directions.
So someone goes to your facility, tell us about the withdrawal, what they go through.
When they go through withdrawal, it can be a miserable experience. We provide medication to help them, to kind of just to help cope with the muscle cramping. They will be craving a lot of muscle cramping, a lot of sleep disturbances, and it's interesting. The appetite doesn't decrease. They will eat like crazy because they're replenishing their body. Their body's been drained, and so they're eating a lot of food, and they're getting medications that will help them. It's not a comfortable detox. It never is. The medicines that we use just simply help keep them at a minimal state of pain or cramping or craving and stuff like that.
what are some treatment options?
Treatment options, unfortunately, that's where we're talking about funding challenges. We have several colleagues in this room that help provide treatment on an outpatient basis. One of the limits that we have in our community in this region are inpatient beds. Somebody comes through Roxy Avenue Center, they detox, they're there about 4 to 5 days, and that's it. And then we send them out back into the community, and that's just not enough. Now, our friends at Carolina Treatment Center, our friends at Fayetteville Treatment Center, our friends all over the community that provide outpatient services, and that's great, but if somebody needs a longer-term treatment option, we end up having to refer them, if they have insurance, anywhere across the state up to 60 to 80 miles from here. So it kind of it's good because they get inpatient treatment, but they don't have the ability for family to come and see them. They don't have the ability to have local resources get plugged into because they're that far away for treatment. Go ahead, Louis.
Well, I want to add to this additionally, due to the governor's opioid action plan, there are actually funds that have been freed up for individuals who are seeking especially medication-assisted treatment. State funding is available for those who are below the poverty level. Our treatment center currently are accepting state-funded people. So if you're below the poverty level and maybe you can't afford to go inpatient, or but you still have to work, you still need to be able to function as a maintenance program, what we do is we try to stabilize that individual so that they can go about their day-to-day. We're also accepting Medicaid. So if medication-assisted treatment, which sometimes gets a bad stigma, but if done correctly, as a comprehensive approach where counseling and medication is being provided and being monitored in a good way, then that person has every opportunity as anyone else who goes in a long-term treatment facility to come out much better than when they went in.
As far as obtaining that funding, who does someone contact if they're below the poverty level?
All they have to do is show up for screening and assessment. We'll check their eligibility and appropriateness, and we can help them do that paperwork and get it started really soon, actually.
Awesome.
And can you let those that are probably just tuning in or listening, but how would they contact you if they needed that kind of help?
Okay, my number is 910-864-8739. Again, that's 910-864-8739, and we're Carolina Treatment Center.
I have a question about intake as well. So I know you said that's people that don't have insurance or that are below low poverty line. These individuals that go in for treatment, are they able to check themselves out if they look like they're healthy or they're going with the plan? Because I'm just basing off experience. Like they say that they're good, they're okay, then it's a couple of weeks, but the program takes 30 days or whatever, you know.
Yeah.
So
when they come in for detox, like I said, the average length of stay is only about 4 to 5 days. A medical doctor will discharge them when it's appropriate, when they're completely done with their detox. We do have a high percentage of people that check themselves out, what is called AMA, against medical advice. They're just not ready yet, but this disease is insidious, and it is calling their name. You're through the worst part of it. You're fine now. You can make it on your own. You don't need help. You don't need to be here anymore. My family's at home. They need me. The children need their father or their mother. So there's all sorts of things that the self-talk can kind of talk them into leaving prematurely from what they should be doing. The counselors that do the assessments, the nurses, the medical team, they all try to convince them not to leave against medical advice, but we know it does happen. It's unfortunate, and it does happen.
Let's just say thank you for listening to Fayetteville Fights Back, a community conversation about the opioid crisis here in Fayetteville. And you're listening to Foxy 99, WKML 95.7, 96.5 Bob FM, Sunny 94.3 and 107.7 Jams. And thanks to Cape Fear Valley, broadcasted as well on their Facebook page. Lewis?
I just want to be clear about one thing about the state funding and being able to provide those Medicaid services. They have to live in the Cumberland County area.
okay.
Doctor, you mentioned treatment 4 to 5 days. If you could write a new statute right now, how long would I need to stay there instead of 4 or 5 days? A week, 2 weeks? Or is there a number?
There is
Kinda hard to say,
there is
isn't
no
it?
number. It depends on the individual.
Kind of a here's your sign question. It's different strokes, different folks.
Yeah, the old days, when I was coming into the field, which is too long ago to count, was 28 days was a good treatment number, but even that's not necessarily sufficient. Some people, it depends on the neurochemistry, it depends on your environmental factors, it depends on what you've got going for you when you get back out into the real world. If I were to pick a number, I would say anywhere from 21 to 35 days. And that just gives them a good chance to get completely detoxed, get as good and clean as they can, and also start kind of building their body back up. As I said earlier, that your body's drained. What you've gone through and put your body through during this time frame has punished your body. And so to get your nutrition taken care of, get your exercise back into good shape, get your some therapy in, get some coping skills, some ways to address the problems that you've got. The more time, the better.
I just wanted to add to the cost of treatment because although we have Medicaid, we have state funding, unfortunately a lot of people do not qualify for that. At our treatment center, Fayetteville Treatment Center, fortunately we're located just 1 block from here. I'm very easy to find downtown. But for as little as $14 a day, you can get all-inclusive, everything you need. You get your counseling, you get your medication, you get referrals, you have a doctor right there on site. We do intakes 3 days a week, walk in, or you can call and make appointments, and we're available 24 hours a day to talk to somebody. As somebody who myself could use, some type of government assistance, but we don't get that type of help because you make too much or whatever other factors fall into place. So $14 a day is way cheaper than $200 a day that some people are spending. I've met couples who are spending $2,000 a week on drugs, and so for them to come in and be able to spend a smaller amount and still be at home with their children, still work their jobs, and not have to be sent off to, Wilmington or Virginia or somewhere that's so far away that it's really not accessible for treatment. And if you don't have insurance and you don't have a lot of money, it's really hard to go inpatient. That's our biggest struggle for patients who really need inpatient treatment, and we don't have nowhere to send them. So any way we could possibly get something in the Fayetteville area or even close by would be great, because even them be able to get to treatment is unfortunate. They can't do that. I know one place that'll actually come and pick you up, but again, you got to work on their schedule. So if you can't get there, it's kind of like catch-22. Like, I want help, but I can't get it. So we're just going to continue working with you as much as we can.
Let me ask, if you don't mind, you mentioned in your $14 a day plan, you mentioned the medication for treatment, which leads us to our next question. Jan and I we were asked today, medicine kind of got us where we are.
Yes.
Should medicine be used to treat?
Well, it's proven scientific method, methadone, buprenorphine, Suboxone, Vivitrol. They're all proven methods, and it's just a matter of how they're used. Are they medically supervised? That's the biggest part. With our treatment, between me and Carolina Treatment Center, is outpatient. Patients come in every day. They do not get a prescription to take home with them. We are able to visually see them every day. So even if they are not doing great in treatment, we're still able to see them, see their behaviors, watch and, see if anything's changing with them. We can do weekly drug tests, we can do monthly drug tests. Anything we need to do to keep an eye on them, we can do that in an outpatient basis. But, that's why as a community we got to work together, because it is outpatient. We do have to work together to make sure that this patient's being taken care of.
You mentioned Fayetteville Treatment Center. You're aware, and let me get your phone number, please.
We are right down the road, 418 Person Street, right beside Family Dollar, and it is 910-483-0958, or you can go on our website, www.newseason.com.
And I would just add to that, if it's okay, that the correct term is medication-assisted treatments, not just medication. And both my colleagues here can vouch for that. There's therapy involved. There's learning of those coping skills we talked about earlier, in addition to the medication. So it's not just, medication got us into this. It's, yes, take medication, but also get the counseling that you need to help you deal with it.
Can I just speak on that? Because that is our biggest stigma, is that we use medication to treat what we do. Medication is a tiny little piece of our treatment. The medication is used to help with their withdrawal symptoms, their cravings, and so we can get them to a point where they're healthy enough to sit down with a counselor, sit down with a doctor, sit down with whoever they need to learn those coping skills, get healthy again, work on any type of mental illness they may have that's adding to that substance abuse, because sometimes those override each other, and we got to be able to work together to get that taken care of.
And I have a saying, and Tabitha's heard me say this before: the medication makes you feel better, but it doesn't make you think better. And so that's why the counseling is important, because eventually the medication will be gone, and now it's about what have I learned or relearned to be able to function fully in society.
Lewis is with Carolina Treatment, 910-864-8739. 864-8739, and you're with Fayetteville Treatment at 910-483-0958, 483-0958.
You two pretty much covered some questions already about Medicaid and free or low-cost treatments. I want to know, are there long-term treatments available?
Do you want to answer
Is there
more of
such a thing as long-term treatments?
Well, there is such a thing as long-term treatments. Most of them are, I would say, hard to get into and very, very expensive. I even did some research today concerning individuals who may want to get into long-term treatment that are struggling with opioid use disorders. But in order for them to do that, they would have to visit a detox center more times than not, because that person has to be free of all of those substances in order for them to get into what would be considered long-term. And when I look at long-term, we're looking at, I'm looking at 90 days plus.
Wow.
Someone on Facebook asked, please mention illegally pressed counterfeit pills. Anyone like to respond to any of that?
Hello, Captain Robert Ramirez, Fayetteville Police Department. I'm in charge of the investigation division where narcotics is one of my units. Yes, we do see that. It's not often, but we do come across these presses. They're hydraulic or mechanically managed presses where they actually make their own pills. So then that means that we have these drug trafficking organizations that are so organized that they have these machines that will produce these pills. They look like real pills, like you get at a pharmacy, but they're not. They're chemically put together in a garage, like the Attorney General said earlier. And definitely that's where it becomes inconsistent with how much molecules are in those presses.
That's, okay, is that more dangerous or equivalent to the opioids? Because that's scary. You don't exactly know what's in those things?
So that's how they actually sell them in the street then. You would think because it's in a pill form, it's probably something that's made in a pharmacy, and it's not. If you buy it in the streets and you buy it in the alleys, it's probably not the best way to get your pills. And these DTOs, as we call them, drug trafficking organizations, produce these pills at home in that form. And it's actually definitely illegal. I'd like to make two more points. Last year, 2016, we responded to 25 overdoses, deaths, investigated by our homicide detectives. This year was over 50. So we do see that increase in that number.
That's 25 last year and 50?
50 in 17. So in 16, it was 25, approximately 25. Last year, we closed at about 50 overdoses, which are related to primarily opioid overdoses. And one last point, at 6 p.m. today, 3 years ago, I removed my daughter from life support due to an overdose. So I do actually say, I commend this actual forum because me, even as a cop, over 20 years of service and doing narcotics work, I still lost my own daughter. So with that said, I want to make sure I can say thank you for having us here.
Thank you for sharing that.
Absolutely.
Just can't imagine. Thank you for your service. Thank you. That breaks your heart.
Yeah, I'll get me crying, Lord. Ooh.
Where are we? I got lost my, are we on the active duty? Yeah, question. How could active duty military get help if needed, please?
Colonel Aljo, active duty, can you say the question one more time, because I was...
Yeah, how can active duty military get help if needed?
Oh, get help. All right, so the alcohol and substance abuse program on Fort Bragg, they can enroll, self-enroll. They can be referred by a medical provider, or they can be command referred by their chain of command. The other avenues is every soldier has a chain of command, and their first line supervisor is the first person they should contact and let them know that they think they may be having a trouble. They can also reach out to the unit chaplain, or they can get care through the healthcare system.
We're running short on time, so what we're gonna do is we're probably more than likely gonna go ahead and do like 30 more minutes after this. I know another live broadcast, so we can talk more about whatever else you guys want to cover that we missed. Not to mention how to dispose of medications that we don't need to have in our house or unwanted medication. And also, I believe we have 2 minutes, right, Randy?
Yep.
You said, okay. So,
This is just exciting. You've got the medical, the law enforcement, the treatment centers, the county, the city, everybody's on the same sheet of page, and I just can't say thank you enough. It's just like saving lives, so thank you very much.
Do we have time to ask one question, Randy? Sure. How about our vets? How can our vets get some help?
I'd like to say that at CommuniCare, we work very well with the veteran population. We even will service the active duty members when they come to us. But we can specialize in trauma and PTSD and a lot of those things that begin them to use and misuse the prescription drugs.
The Veterans Administration of Fayetteville also has agreements with local area establishments to get veterans the help they need if they can't handle it within their own walls.
And I would also add the Stephen A. Cohen Military Family Clinic at Cape Fear Valley provides a range of mental health services, including substance abuse as well.
All right, we'd like to thank all of our guests, Cape Fear Valley Health, and our Beasley Media Group staff for pulling all of this broadcast together.
Our conversation continues via Facebook for another half hour, 30 minutes. In fact, coming up, we have a demonstration like Jane said. If you've got unused medications, unwanted medications out of date, guess what? We'll show you how to properly dispose of those unused medications safely and properly.
And this concludes our hashtag Fayetteville Fight Back, and we now return to our stations to regular programming. This has been a production of the Beasley Media Group. Thank you.